Let's dive into thoracic mobility during pregnancy. I'm Dr. Nichelle Gurley, and I'm specialized in prenatal and postnatal movement. A lot of times the mid-back can become really tight during pregnancy. There's a couple reasons for this. One of them is that our bump is getting big, so we get a little bit more of a curve in our low back, which causes a little bit more of a curve of our thoracic spine. It's kind of like scoliosis, where there's oftentimes a lumbar curve, and then we get a thoracic curve, or there's a thoracic curve, and then we get a lumbar curve. So somebody with scoliosis is able to look like they're standing upright because they have a double curve. So for us, if we didn't get a little bit of a curve in our mid back, we might just be walking around like this, which is kind of that classic, like, make fun of us pregnancy waddle. But most of us don't waddle like that. So we get a little bit of a curve here, and our spine compensates by getting a rounded mid back. So that mid back can get tight. Another thing that can happen is that because our belly is stretching and growing, our core is getting just a little bit weaker. It's harder to keep that good posture. So when we're seated all day long, we tend to round a little bit more in our mid back than we usually would. So a couple things that we can do are cat cow, thread the needle, and open book. So cat cow, a lot of people have heard of. Hands and knees, making sure your shoulders are stacked over your wrists, your hips are over your knees, and you're going to push the ground away and curve that back, allow your neck to follow and round. And then you're going to drop down, relax that belly, and allow that neck to come up. A nice breath pattern is inhaling as you push through into cat. And exhale, relax your belly, allow your neck to come up in that cow position. So I'll do a couple here. Now that is for flexion and extension of that mid back. To get rotation of that mid back, we can go ahead and place our hand behind our neck and do thread the needle. So I'm going to drive my elbow up on my inhale, and on my exhale, I'm going to drive my elbow through. So I'm getting rotation here. So inhale and exhale, thread that needle. So that's for thoracic rotation. Another thoracic rotation is an open book stretch. And this one you will do on the ground. So you're going to come down to the ground, lie on your side. We're going to have a closed book here, arms out, hands touching. You're going to have about a 45-degree hinge right here at your hips. And then what you're going to do is take one hand and bring the back of it to the opposite side and open up that book. So I'm trying to get my wrist and my shoulder onto the ground. Close that book and repeat. And you would do this on both sides. So for that mid back, that has a couple reasons as to why it can be tight during pregnancy. You can do cat cow, thread the needle, and you can utilize the open book stretch as a couple options.